In this video, we're going to look at respiratory volumes, and they're important so we can assess respiratory status. Typically, a spirometer is used, you can see that in the picture here, to assess these volumes. There's electronic measuring devices, which are much better, and most clinics use those today. And these volumes that we're measuring usually are abnormal in people with pulmonary disorders. So let's look at normal volumes. There's a lot of information here on this graph, so let's go over all of these volumes and numbers, which is really good to know. First off, this is the tidal volume. It's about 500 milliliters, which is half a liter, and that's just the amount of air inhaled and exhaled, just under a normal breath, under resting conditions. Tidal volume. Inspiratory reserve volume, which we can see right here in this darker color blue, is the amount of air that can be forcibly inhaled after a normal breath, after a normal tidal volume. And you can see, compared to 500, we have an extra 3,600 milliliters of inspiratory capacity. That's of inspiratory reserve volume, not capacity. Then we have expiratory reserve volume in this other color of darker blue under the tidal volume, and that's the amount of air that can be forcibly exhaled after a normal tidal volume. We can see expiratory reserve nowhere near as much as inspiratory. It's 1,200 milliliters. But then we have air left over in the lungs that we call the residual volume of 1,200 milliliters, and that's air remaining in the lungs even after you force all of the air out of your lungs. There's always some left over. 1,200 milliliters, that's your residual volume. So our total lung capacity are all of these volumes of all four of these colors, all added together for our total lung capacity of 600 milliliters, or 6 liters, another way to say that. Now we have some other measurements here that we can use, something called the vital capacity. Right here, vital capacity includes everything except that residual volume. So it's defined here as amount of air that can be expired after maximum inspiration. So maximum inspiration, then force all your air out, there's your vital capacity. So it does not include the residual volume. So we have an inspiratory capacity, and that's basically tidal volume plus inspiratory reserve. So take tidal plus that inspiratory reserve, there's your inspiratory capacity. Functional residual capacity, which we see right here, is your expiratory reserve plus your residual volume. So that's volume remaining in the lungs after a normal tidal volume. So there's all of our normal measurements and our definitions of all of these volumes and capacities. And we have some dead spaces. An anatomical dead space doesn't contribute to gas exchange. It's just air that remains in the passageways. Alveolar dead space is space occupied by alveoli that aren't working. Perhaps there's an obstruction. So the total dead space is all of this dead space put together. So what spirometry can do is look at those numbers that we just went over and distinguish between an obstructive pulmonary disease and a restrictive disease. Because if there's an obstructive pulmonary disease, like bronchitis, for example, certain volumes will actually increase. Total lung capacity, functional residual capacity, and residual volume actually increase because the lungs are hyperinflated to try to compensate for the obstruction. If it's a restricted disease, like tuberculosis or exposure to environmental agents, for example, something restricting respiration will cause these capacities or volumes to decline because expansion is limited. So vital capacity, total lung capacity, functional residual capacity, residual volume, everything we've seen up here, but we added vital capacity, those decline with a restrictive respiratory disease. So other pulmonary function tests include the rate of gas movement, like forced vital capacity, expelling air after taking a deep breath, exhale maximally and as rapidly as possible. So time is also included in these measurements, which is why we're measuring the rate of gas movement. Forced expiratory volume, amount of gas expelled during a specific time interval. So these rates can also tell us vital pieces of information about the respiratory system. There's minute ventilation, the amount of gas that flows into or out of our tract in a minute. Alveolar ventilation rate, flow of gases in and out of the alveoli during a particular time. So these rates can be measured against normal rates. And there's an equation to calculate AVR. I'm not going to go into this in any detail here, just as long as we just understand what minute ventilation and alveolar ventilation rate are.